You have tried rest, rehab, pain medication, even scans, but your knee pain keeps coming back. It's random, it flares for no reason, and the treatment that works for others, they barely touch it. What if I told you the real problem isn't in your cartilage or your posture, but in your immune system? Hi, it's Antony from NxHLife. When people experience knee pain, the first thought is usually overuse, cartilage wear, or maybe an old injury flaring up. But for many, especially younger adults, or those whose pain seems random, persistent, or fluctuating, there may be something going on. These type of pain may be inflammatory, not mechanical. Inflammatory arthritis isn't just about joints, it's about a systemic condition. That means your immune system is involved. And when it gets confused, it can start attacking your own joints, including your knees. This is where the spondyloarthritic families of conditions comes in. Let's unpack what these conditions are and how they affect your body, how they could be the missing piece in your pain story. First up, psoriatic arthritis. This is an autoimmune condition that affects up to 30% of people with psoriasis, even if your skin symptoms are mild or appear after the joint pain. It often targets joints like knees, fingers, and toes. What makes it different is something called ascites, inflammation where tendons and ligaments attach to the bone. This can cause a deep achy feeling around your knee that feels different from regular arthritis. If you've had flaky skins, nail pitting, or family history of psoriasis, this might be your root cause. Next is axial spondyloarthritis, or axial SPA, sometimes called non-radiographic SPA or ankylosing spondylitis in more advanced cases. It mainly affects your spine and sacroiliac joint, but it can also hit your knees, hips, and ankles. Symptoms often start before age of 45. You might feel stiff in the morning, then better after moving. It can also come with fatigue, eye inflammation, or gut symptoms. And here's the thing, your scans may come back normal, but the pain is still real. If that sounds familiar, it's time to investigate further. Here's something surprising. Your gut could be connected to your pain too. Conditions like Crohn's disease and ulcerative colitis are also known as inflammatory bowel diseases, or IBD. And up to 40% of people with IBD experience joint pain, especially in the knees. Sometimes the gut symptoms are obvious, diarrhea, bloating, or weight loss, but other times the joint pain shows up first, then the gut symptoms. This condition is called enteropathic arthritis and often flares alongside digestive knee inflammation. Next, we've got reactive arthritis. This type of arthritis develops after an infection, usually from the gut like salmonella or from the genitals like chlamydia. A few weeks after the infection clears, you start feeling joint pain, often in the knees or ankles. Your immune system is reacting to that old infection, but it keeps attacking even though the infection is gone. So reactive arthritis can also include symptoms like red eye, urinary issues, and joint swellings as well. Another subtype to know is peripheral spondyloarthritis. This mainly affects the limbs, especially the knees, heels, and toes. It can look like repetitive tendon injuries or chronic bursitis. So, how do you know if your knee pain could be autoimmune? Here are some of the red flags. Pain that's worse after rest, especially in the morning. Swelling that comes and goes. Fatigue, eye issues, skin or gut symptoms, or even a family history of psoriasis, IBD, or any autoimmune diseases. If your pain started before age of 45, isn't tied to a clear injury, those are the signs it's time to dig deeper. Autoimmune causes of joint pain aren't curable, but they're manageable. Early diagnosis is key to slowing disease progressions and protecting your joints. Treatments might include anti-inflammatory or biologic medications or diet, physio focus on mobility and strength, gut health support, and mind-body practices to regulate your immune system. You deserve more than a generic treatment plan. If your current care isn't helping, it might be time for a second opinion. Chronic knee pain isn't always about cartilage or old injuries. Sometimes it's your immune system trying to tell you something. If anything in this video sounds familiar, don't ignore it. The sooner you find the root cause, the sooner you can take action. Like this video, subscribe to our channel, and share it with someone who has been struggling with unexplained knee pain. And if you want to dive deeper into healing chronic pain holistically, check out our 5 days mini course. It's free for now. The link's in the description below. And stay curious, stay hopeful, and I'll see you in the next video. Bye.